Hello.
How's everyone doing this evening?
You guys are just getting settled in. Feel free to turn on the mics for a little bit and
Yeah,
even
we're
pop
gonna
the video on if you're comfortable with it.
yeah, so it doesn't so I'm not just talking to names if you guys are okay with it. This is gonna be a little bit of a interactive webinar. So you guys are gonna not just be listening to Will and I talk the whole time, which is probably a better thing.
Yeah, I agree with that. I mean, we'll do it if we have to, but
Who's gonna be the first person to turn their camera on and say hello?
yeah,
Let's go.
How you guys doing? I'm just setting up my space here. Thanks for
Nicholas.
organizing this and
Yeah.
giving us such an informative session.
Oh, it's informative already. We haven't even started. That makes me happy.
I'm just glad to. I've been listening to the podcast for a while now, and all of those have been very informative, and I think this would be as well. So thank you for setting this up.
Cool. Yeah.
exciting.
Where are you from?
I'm currently at home in Richmond Hill right now, but I went to Western for physio school, and I just finished.
Heck,
And now I'm just figuring out where to go next.
Cool, man. That's awesome. Congrats on finishing.
Thank you.
We'll probably wait like another minute or two here, and just see if anyone rolls in. We had a couple more people signed up, but um, you know how these things go. People sign up and forget, or sign up and it's a beautiful night and they want to just enjoy the night. So it might just be us for the seminar. So we'll give a couple more minutes here that we'll get in. But with you guys here, like we are going to be doing like some interacting with each other. So like we are gonna have you guys like go into like a breakout room, have you guys talk amongst each other. So uh, be prepared for that. Obviously, it's not going to be anything like crazy pressure, but you're going to be interacting with each other. So yeah, just give you the heads up now.
just conversations.
All right. Well,
Get rolling.
let's just get rolling, and then whoever comes in, we'll let them join.
Yeah. Yeah.
So yeah, you guys, thanks so much for joining us. We're super pumped about this. The first little webinar Will and I have put on for the mentorship. So we're excited to have you all here today. So what the session will look like is we're going to kind of take you through a part of what we go through in the mentorship. And then we're going to have you guys interact with each other on the Zoom call, how we have people interact with each other on the Zoom call in the mentorship. And basically what we're talking about today is the micro and macro purposes of the initial assessment. We'll talk about this like iceberg approach to your initial assessment, to kind of have you guys start thinking a little bit more about how you can get the most out of your initial assessments. One thing that we originally found coming out of physio school was that we had a whole bunch of clinical knowledge and a whole bunch of clinical skills, but we didn't really know
Yeah.
how to set up like a session and make
சொல்லுப்பா
that super
வீட்ல
make
இன்னைக்கு எனக்கு
that
கோர்ஸ் இருக்குன்னு உனக்கு
super
ஏற்கனவே சொன்னேன். எத்தனை வாட்டி தான் சொல்றது? இன்னும் 7 மணிக்கு எனக்கு
make that super effective. So I'm going to share my screen with you guys here. And we will get into it. So this little portion of what we're going to go through today is from our module called How Simple Practice is a Better Practice. So the most important thing is we're always going to be promoting coffee. So I know it's a little bit late for coffee today, so I'm sure no one's really sipping any coffee, and that's okay. But that is definitely something that we're super passionate about. But complex is not better. So we believe that becoming a beast at the simple things can help us communicate more effectively with our clients, help us make better clinical decisions, and ultimately get better outcomes. So although complex might not be super sexy, it is hard to deliver on. So just because something is simple doesn't mean that it's easy. And what we want to go through today is giving you some of the frameworks that we use to try and simplify our initial assessment process to make them more effective. So when you were in physio school, this is probably what you were taught to do. Remember every special test, go through every manual muscle testing, know all the grades, know all the range of motions, know every single degree of what your shoulder range of motion should be, know the exact treatment that's going to help fix the pain for someone. There's a lot there, and this can be like super overwhelming, and oftentimes made us feel like this person, super stressed, anxious, burned out, a little confused. I remember there's multiple times in physio school where Will and I were highly considering just opening a coffee shop. So if you guys ever felt this way or continue to feel this way sometimes when it comes to delivering an initial assessment, or just sometimes delivering care, like we totally understand where you're coming from. Overcomplicating your sessions can lead to like more anxiety, more confusion for you. And a lot of times I find this is why people feel this need to take all these courses, is they're like, okay, I need to fill this with more information, which we actually think sometimes isn't always the answer, and can actually like drive a vicious cycle of then feeling like, okay, now I have more information that I don't know what to do with and how to utilize it, which can just drive more of that anxiety and confusion that you're already dealing with. And the one thing that we've realized is the more like comfortable and confident that you can feel as a clinician, the more likely you are going to have good interactions with your clients, the more likely they're going to want to interact with you, you're going to build good relationships. And ultimately, we know all those things are really important to getting the outcomes that we're looking for with our clients. Yeah, so having too many tools and going through too many tests actually ends up taking away a lot of times of what we think is important. There's a little clip here that I'm not gonna click on, but it kind of basically just shows me being assessed by Will, and Will is just doing all of these different tests to me, and I'm extremely overwhelmed, and we're just like, okay, this is not what you want to do as a clinician. And I feel like sometimes it ends up being what we do. So what we're going to go through today in the module is diving into the initial assessment specifically. And what we're going to start off with is we're going to have you guys go into a little breakout room. So you'll be interacting with each other, and we want you guys to just talk about, brainstorm some ideas of what you guys are trying to get out of your initial assessments with clients. So what is the purpose behind the initial assessment for you, and what are you trying to get out of them? There's no like right or wrong answers to this. Like we don't like think too much about it. Don't be too worried about what you're discussing, but try to come up with some things that you guys feel like is the purpose of your initial assessment. And then we're going to come back into the break after the breakout room, and we're going to talk a little bit about what you guys discussed, and then we'll bring you into how we view the initial assessment and go through that. So I'm going to split you guys off into breakout rooms. I think Will is going to be in one of these breakout rooms, so you guys he'll kind of maybe pop in, help you facilitate it. I'll be in and out of the breakout room as well, to just kind of make sure that you guys are feeling okay with what we're going through. I just need to figure out how to get to the breakout rooms.
So, unmute and we'll get on video if you're able to. That way we can have a conversation.
All right. All right. And then we'll give you guys probably about, 5 to 8 minutes, let's say, of conversation. And then Will and I will be popping in. So go ahead, join the breakout room, and we're going to talk about what you think the purpose of the initial assessment is. All right. Let's see if everyone is back. Seems like one group's still chatting. They must be having some good conversation.
It's never a bad thing.
No.
I always get stuck in one group and I'm like, I wonder what's going on.
Yeah, I want to try to move you, but I couldn't. So
Okay. I appreciate the effort at least.
I almost exited you from the whole call. So should close in 1 second here. All right, sweet. Okay, we're back. So what we want to do is we'll have like one person maybe from each group just share a little bit of like what the main kind of themes were that you talked about. Like I popped into each room, so I'll just pick someone. Why don't we have like whoever was in Nicholas's room, let's have someone from that room just jump in and share like some of the summary notes from your conversation of what you guys had.
I think we all kind of agreed a little bit, but what we mentioned was in that initial assessment, it's more about like getting to know the patient for who they are, what their goals are, what they want to get back to, and what brings them in really, more than like, all the special tests and everything. For myself, I mentioned that during my clinical placements, that was more important to me. And then like as the treatment session's gone on, or like closer to the end of the initial assessment is when I bring out like a few special tests to kind of give me a working diagnosis. And over the next few times I see them is when we kind of head more into a specific direction, because I kind of find that a lot of conditions you kind of treat very similarly. So I find the treatment doesn't change much, but getting to know them is definitely the most important thing right off the bat.
Cool. Yeah, no, it's good. That'll segue nice into like what we hit on, for sure. Like that's definitely a big part of what we talk about in the initial assessment, and I would say that hits on a lot of like our macro focuses of the initial assessment, which I think is a super important piece to starting off like a relationship or a connection with someone. So that's great. Why don't we have Josh? I think you were in a different group, right?
Yeah.
Why don't we have you? Why don't we have a go at it and share some stuff?
Ours was pretty similar. Like I think we all started with like building a relationship and rapport with the patient as they come in, and then creating that trust, and then kind of once you have that going from there. And then it was kind of addressing their primary concern. And then we also chat a bit about just ruling out any red flags that you might pop up as well, which seems pretty important.
Yeah. And when you guys talk about like addressing their primary concerns, what does that mean?
More of a general look versus a specific like, oh, this is the problem. More of a global, okay, this is like what they're coming in complaining of, or they can't do this in their sport, or just keeping it a bit more general. And then as your treatments develop, you can kind of narrow it down.
Cool. Yeah, sweet. And then there was one more group. Would have been your group, right? Well, you and was it Parth and
Parth would be able to give a go.
Yeah. So we kind of talked about trying to see why they came in today rather than like, oh, maybe like a week ago or a month ago, like what kind of triggered it. Trying to understand what their concerns are, what their goals are, and trying to give them trying to give them like some sort of like realistic plan of action early on, so you can kind of see if like they'll be compliant with it and kind of changing that up. But yeah, we kind of talked about goals.
Yeah. Cool. Yeah, no, that's good stuff. And I mean, you guys are hitting on a lot of key things, and I think like heads are definitely in the right place with like, you know, looking at building relationship, building rapport, trying to understand why they're there today, like start to get a general idea of what's going on and think about, okay, how can I start to now implement some maybe different assessment tools that I have to be able to pull out some of this information that I want as a clinician. I guess before we go into like showing you guys kind of how we break this down, I'd be curious to hear what are some of the things that you find you struggle with the most in the initial assessment right now? Like, is there certain things that you're finding like that are really giving you trouble? And feel free to just kind of like unmute yourself and share.
I think one thing that I've noticed over my placements, and it's gotten better, but definitely like the flow of like what I do first and second. Just like getting them from a laying down position, like supine, to sitting up, to standing up, to back down. Like I just want to make it more seamless, if you will. That's one thing I feel like I've been struggling with.
Yeah. Yeah. That's good. Anyone else have any thoughts on that? Anything they're struggling with that's a little bit different, maybe?
I feel like I struggle with like timelines, like providing a good prognosis or like timeline depending on what it is, especially on those like tricky chronic ones where I really feel like it could take like 6 months or whatever. Sometimes that buy-in is not so fun when they hear such a long trajectory.
Yeah. Yeah, that is definitely a challenge. That is definitely something that we all still have to navigate. And it won't be exactly what we touch on today, but it is part of something that we talk about, and why it's super important to have like a plan, like a 3-step plan is like what we integrate, and like we really show people like what the process is going to look like. Um, and we find if we're very clear as to like where they are, where they need to get to, and this is why it's really important to identify like goals and whys and like all of those things with the client. As long as we show them that and we show them how we're going to take them there through like a 3-step process, we found that the prognosis doesn't matter as much as we think when it's very clear of showing them a picture of where they are to where they want to go. I think where we've had struggles is where we don't do a great job of that as clinicians. Like I've noticed when I maybe don't have a great plan laid out, or I haven't done a good job establishing goals or like showing timeline, like that's when it's really hard for them to be like, oh yeah, like I can see how I'm going to get there in 6 months. But part of what we'll go through in the initial assessment will help here, I think. Go ahead, Will. Are you gonna say something?
No, I agree with that. I think it'll help a little bit, because I think what sometimes we forget is like there's another person while you're like going through all these tests, and like I think part of that is just getting stuck in that cycle of like trying to just view the session as like purely problem solving, when you're really like working with another person. So I think like part of what we're going to go through today is kind of slowing things down and diving a little deeper. And I think it was part that mentioned like building the plan, right? So you're kind of like using the stuff that you're doing to help build that plan, to help paint a picture for that person. And when you're doing some of these things that we're going to get into with like focusing on building a relationship and not getting too lost in the weeds, then that person's going to feel better about the length of time in that plan, versus if you're just going through a bunch of stuff and they're not really involved with kind of what's happening, then they see that 6-month timeline or whatever. It's a real shock, right? Does that make any sense?
Makes some sense to me.
Good.
But I'm biased to you, Will. So yeah, we'll go into the next part here. So we split it into a macro and a micro purpose. I think it again, like Nicholas talked a little bit about like structuring things. Like we found when we put like some structure and some frameworks around this stuff, it's very helpful for us to make sure that we're going through the same thing every time when we're going through the assessment. So when it comes to like the initial assessment, the macro level purpose we find is beginning a new relationship. You're building trust and you're trying to establish like commitment with someone, which a lot of you guys touched on this stuff with within your group, and it seemed to be at the forefront, which I think is really great. I think we want to really be focusing on how we can build trust, start to build a relationship, because the only way you're going to be able to have someone go through a full plan of care is if they're committed and they trust you. And so that's a big part of what we want to try to drive in the initial assessment. And then we have the micro level purposes that we think help to enhance that trust, that commitment, and that relationship with the client. And what we feel like we're doing as clinicians is we're trying to identify problems. We're then going to communicate those problems effectively to the client, and we're going to start to create solutions to those problems. And again, start to communicate how we're going to implement those solutions to help them solve the problem. And so this is kind of how we break it down and think about it. And then we take our objective testing and our subjective portion of the assessment, and we utilize those things to fulfill on these macro and micro level purposes. And we'll kind of get into that here, which I'll let Will kind of take over from this part because he really does a good job of explaining this.
Well, you might just have to be clicking the slides along as I go through.
Yeah,
but
I got you.
Yeah, so someone mentioned red flags. We obviously want to be making sure that we're doing that. But it still kind of applies, we're talking about like building relationship, building trust, even with red flags, because most of the time with red flags, they might emerge over the course of the plan as well. Like and you need space for that. Like some of those things that you might see are sensitive topics and require trust too, right? And so obviously screening them for them right away to see if there's anything that obviously, precludes you from doing testing. But keep in mind that, I've had things kind of pop along the way as well. And that can be normal sometimes. These things aren't easy to find always. But yeah, so just we kind of highlighted a few tests, like a few types of tests, and just kind of showing you that it doesn't seem like a whole lot, when you first look at it. But we'll have Dalton go to the next slide there. But we're just unpacking like one single test, and if you think about just the shoulder joint, just range motion, there's a ton of assessments. So when you actually think about it, trying to get through everything is going to be virtually impossible, and you kind of look like a crazy person, and I think we've all been there, myself included. I know Dalton as well. But this is just to highlight how many tests, if we were to actually go through everything, it's not really that feasible.
And that's just picking like just the range of motion. Like that's not even taking into consideration like all the other special tests you might do, all the manual muscle testing you might do. And the purpose of kind of showing you guys this is what we want you to think about utilizing a micro and a macro purpose of the assessment is being intentional with which tests you do and trying to get the most out of those tests. So you're not just like flying through a bunch of different things and moving the person from lying to standing to sitting to lying to standing to sitting and doing all these different tests. Being more intentional with how you're implementing them and getting the most out of that information, which you can see how that would be stressful to the client if we were just doing all those things.
Yeah, and like this is highlighting how like day one isn't going to be the only time you can go through that test, right? And Dalton just kind of described it a little bit here, but basically if you go through even one movement and you fulfill kind of the stuff that we highlighted, so building a new relationship, right? Building trust and establishing commitment. You can do that with one test, right? You can fulfill all those purposes, and then you can identify the problem. You can communicate what's going on, and then you can use that to create a bit of a plan. So, we'll go through some examples later, but it's easy to see how one movement, one test, you could get a lot of that information. And so we're trying to look here. So we're going to talk about a shoulder flexion isometric, and we're going to use this iceberg analogy that we like, which, what we found with a lot of people we work with, especially new grads who are kind of getting their feet wet, is they tend to be on that top layer of the iceberg and then kind of bounce laterally to other tests or other exercises. And they're always thinking about what's the next thing that I can do. And what we're trying to encourage you to do more of is to like really think vertical. So dive deeper into the things that you can get from something. So these are a few examples for like a shoulder isometric, right? So there's tons of things that you could be looking at and evaluating while you're going through that test. Like, is it, something that they were worried about doing before they went through it, right? Did you ask them how they felt or what they thought about the exercise, right? So there you're getting into, obviously the sensitivity of the tissue and the area, but you're also getting into what they think about it, right? So what are maybe some of the cognitions, beliefs about that are going through their head, right? Are they confident? Do they understand how that movement and the discomfort relates to maybe their goal or what they're struggling with? Do they understand why it's uncomfortable and how maybe training that movement could help them get out of pain, right? So there's so many things that you can explore, and sometimes you can spend 10 minutes just going through like one movement, depending on what they might bring up. Like, oh, I was told that by a doctor that I should never raise my arm this high, or I should never lift more than 5 pounds. It's like, if you go, okay, sweet, now we're going to do external rotation, you're sort of missing the forest through the trees there, right? So that's what this is intended to highlight. Do you think I missed anything, Dalton?
No, I think it was good. And I think it's just like the way you can tie it back into, using the micro and the macro purposes is that like if you're establishing a relationship with someone and you're listening to their goals and you're identifying some of their problems, you can then utilize these tests to come back to how you're going to provide a solution for them to help, right? So if they're fearful of lifting their arm overhead and there's pain with resisted testing, and there's someone who has to work overhead or is an overhead athlete, you're then able to come back to later on, like, hey, how when we initially tried to do that test and there was pain, well, what we're going to do is we're going to do another variation of this that's a little bit less intense so that we can start to load the area. And then that's going to be able to like get you back to getting overhead and being able to, undo a light bulb, because that's what like is required for your job. So you can take like those tests and reuse them on the back end to communicate the solution that you have to their problem and make it a lot more relevant to them than just going through a bunch of different tests, collecting a bunch of information. And now you have information, and what are you going to do with that information? And oftentimes we spend a lot of time collecting that information that we don't then have enough time at the end of the assessment to then tell them how we're going to be able to provide a solution for them with the information that we've gathered, because we've utilized all that time. So being more intentional with the test and getting more of information out of it and doing less tests is going to give you more time at the end to connect all these dots for clients, which is ultimately the most important thing to getting them to commit and come back and stick around for more time with you. So slowing down that initial assessment is like a key thing, and like stopping and thinking about, okay, what can I actually pull out of this from each client? So the 3 steps of the initial assessment, like, identifying the problem, communicating the problem, creating a plan with solutions, is like the kind of 3 steps that we like to go through to be able to keep ourselves in check and make sure that we're hitting on the things that we want to hit on. So what we're going to have you guys do is we're going to go into another breakout room. and we're gonna have you guys talk about what we're gonna have you brainstorm what information you can pull out of having a client who is dealing with like patellar tendon or knee pain by utilizing the assessment tool of having them do a squat. So what information can you pull out from that one test from a client that has patellar tendon pain, and just start to kind of accumulate all the different things that you might get from that test. I'm trying to think of like, Will, do you have an example or like something that maybe could like kind of stimulate some thought?
Yeah, so I was thinking about sorry, I was I missed a little bit of what you said there.
I was just saying like, using the squat assessment tool
Yep.
to pull out as much information as you can. Like, is there like an example that you might have with something like that?
Like kind of going through and using the steps.
Yeah,
Like
what?
iceberg
Yeah,
approach.
no, like more of like giving, like I want them to go and brainstorm those ideas, like what they
Right,
can get out of it. Is there something that, what would be an example of that?
Gotcha. So what I was thinking is everybody can imagine that you're going to be assessing someone that has knee pain. And so you're going to be assessing them by having them go through a squat, right? And so what we want you guys to think about is when they go through that squat and they have knee pain, think of all the things you could be paying attention to, or trying to observe, and kind of utilizing that iceberg approach. So thinking beyond just pain and maybe range of motion. Does anybody have questions about that? Does that make sense? Cool. Perfect.
Cool. We'll send you guys to breakout rooms, then we'll work together on this.
On breakout.
Yeah.
Good, yeah.
I'm glad you had fun. We had fun too.
I'm glad you had fun.
Okay, I think we have everyone back. Well, why don't we have someone from your breakout room highlight some of the things you talked about?
Sure. Let's have Julia share some stuff.
Okay, so I think prior to getting them to do the squat, we wanted to kind of dig deeper on why we're choosing a squat. So in their day-to-day, what are they doing? And if that's like working from an office chair that they need to get up and down from, or I guess in general, everyone needs to kind of get up and down from a chair, but kind of seeing if that's an important movement for them that they're missing in their day-to-day activities. And then from there, kind of just giving them the floor to have the freedom to try out a squat and see how that feels in whatever way that feels comfortable for them. But also like noticing, like almost asking like, okay, we're going to get you to do a few squats. How does that sound? And kind of seeing how they feel about that, if they're hesitant even prior to doing the movement, if they're not looking forward to it, if they, are already like stressing about their form and things like that. And then I guess just allowing them to do the movement, looking at like range and not only range in form, but also are they holding their breath? Are they making any faces? And then playing around with different kind of factors in terms of if we notice that they're uncomfortable, probing about that or changing different range and stuff like that.
Nice. Yeah. There's a ton of stuff you can you can pull out of one movement, right? Like I'm sure that's something that you guys definitely highlighted, and you hit on a lot of things there as well. So that's a lot of kind of what our group covered. I'm trying to think of, I can't see anyone's faces, and I don't remember specifically names from people in my group, but I want to say Jasmine. I remember Jasmine Coe. Jasmine, is there anything that we talked about that you want to add to that?
Yeah, we looked at more physical factors. So like when do they have pain in the squat, on the way down, on the way up? Are they how much depth there are they able to get? And is that limited by pain or a lack of range of motion? Not in just the knee, but the ankle or the hip or somewhere else along the chain, or is it limited by fear? And trying to remember what else we talked about, but just like kind of addressing that fear and like helping them slowly realize if it is just purely fear that they're not able to get into a full squat or more depth, like get them on a TRX and then help them increase depth that way, make them realize, oh, they can actually like squat a little bit deeper than they thought. And it might be more of a cognitive or psychosocial driver rather than a physical one.
Yeah.
Nice.
Yeah. I kind of had them think a little bit, and this is kind of what you guys can think about as well, is like, what do you do with this information once you get it? Once you're identifying that there's something that maybe influencing this person's goals, it's like, now what do you do with it? Which is what I kind of probe them on with regards to, like, okay, there's some fear. You identify that there's some fear with squatting. Now, what do you do with that information to try and help them help position yourself as someone who can solve their problem? And one suggestion that I given was like, oh, maybe we have, we try with the TRX and just see what happens, and then they can go farther. And then you can start to question them, well, if this was because you have a torn ligament, like how would you have been able to get more range of motion by just using the TRX? Like you can utilize those things and try to have them see how you can help them overcome some of those things that are keeping them from getting to their goal. So really making sure, okay, what am I going to do with this information now that I've pulled it out, is something to think about as well.
Yeah, and as Jasmine was talking there, I was kind of thinking, like, we're obviously looking at this assessment in a bit of a vacuum, like you're going to have their history and some of the context prior to going and doing this. And so, even if you're thinking, like, let's say someone was a CrossFitter and they were saying that they only really started feeling the discomfort like later on in the workout, right? So you might then with that person know, if I just do 5 squats, they're probably not going to feel any discomfort and it won't really show that much. So you might have to take that person through like 3 sets at a working weight, right? Like a challenging weight, and actually challenge their endurance and see what you can see. So that's another example where like you're using what you're getting from the subjective and your conversations with them to sort of understand how you're going to dive deep into whatever you're assessing.
Sweet. Like always, Will and I talk too much and we end up going over time. I want to open the floor to you guys. If you have any questions, thoughts around the stuff that we talked about today, if there's any other kind of questions that you guys had, feel free to we'll give you a little bit of time here to ask them, and then we'll wrap this thing up and get you guys on with your evening.
I don't think I have any questions, but I appreciate the webinar, and I think it's a good reminder to kind of slow down in my assessments and to not just go after every special test because I hate them. So it gives me a good reason to avoid them.
Yeah. And like one thing we try to do is like make this stuff tangible. So like, you know, you guys are in the middle of practicing right now. Most of you, it sounds like it's like, think about, you know, think about your assessment, and maybe before you go into your next shoulder assessment that you're seeing, like pick only a few things that you're going to do in that initial assessment to try to pull out, you know, the information that you're looking for. And then how do you utilize that information? Like almost try and give yourself a challenge of, okay, I'm actually not going to go through a bunch of different things. I'm going to focus on a couple things, and then I'm going to use the other part of my time to really dive into like their why and their goals and spend some time on that. Then I'm going to go through those tests, pull out as much information as I can, and maybe I'm going to like dive deeper into one of those things. If I do a shoulder test and someone says, oh, I'm really worried about doing that, like maybe you dive deeper into that and you stay on that topic for a bit. And then at the end, make sure you have time to try and connect all the dots between like their goals that you identified at the start, the information that you pulled out with those few tests that you did, and then how that connects to what you're going to do to help them get back to what that goal is, and try and do it that way and see how that goes. Like brainstorm a couple of things before you go into your next assessment.
Yeah. Well, thank you.
Yeah, no problem. Anyone else have any questions?
Sorry,
Cool.
just one quick question.
Yeah,
Sorry.
go for it.
I was wondering if like that slide deck that you were going through, like we can have a copy of that maybe to like just look at the information that you guys are providing.
We're gonna send out a recording, the recording of this. I don't think we have like the mini. We can maybe put a couple of slides together and send them out. This is like the bigger. This is a bigger slide deck of like the whole mentorship thing, the whole PDF. But we can maybe send out a little summary of like what we talked about, and then you guys will get the recording, so you can go back on the recording and like check out like if you want to write down some of those things that we talked about there.
That's great. Thank you.
Yeah. And then, okay, two things. Jasmine, do you have something?
Sorry, I don't want to keep people waiting. But I was just curious, like some of the weird things when we were talking about red flags that you guys saw, like some examples for weird red flags you found later on, not just in the initial assessment, but later on in the treatment.
Yeah, I mean, like, so I've had people where like they have a shoulder issue and it's just kind of not really getting better, and you're noticing it's not really following you know, like a typical musculoskeletal sort of presentation. And like, you know, the one example I'm thinking of is really a red flag, but it ended up being like a gallbladder issue. And so they took it out basically, and that solved the person's problem. So that was just like, I was kind of like, this is sort of weird, like it's not really responding to things. So that was one example. I've also had people get MRIs on their back and have sketchy findings show up on the image, but then when I go and assess them and dive deeper into the red flag questions, they don't necessarily correlate with the MRI findings. So I've had that come up too for things like, you know, cauda equina, believe it or not, syndrome and stuff like that. But those are the couple. These things don't come up all the time, you know?
Yeah, I was just curious.
But
Thanks.
I think we brought that up because it's important to just keep an eye. Like, it's never like check it off and then you're good. You know, it's important to like pay attention, and just if you're having a weird feeling that something's like not really following a typical presentation, like explore it, right?
Cool. Yeah, so just before you guys head out, there's a couple things. One, we have a little secret surprise for you guys for joining the webinar. Will and I have been working, like, if you guys have been following us along, I know there's some people who follow the podcast and who have been like listening or been just like following us on Instagram and stuff. Will and I have been working really hard on like putting out a website for the mentorship and the podcast itself. So we just kind of finished it up. So we'll give you guys a little bit of a sneak peek of what it looks like. More just because Will and I are super excited about it and we have no one else to show it to anymore. So like we want to show it to you guys. But essentially like the website's just going to take you more through like what we're trying to transition the podcast and the mentorship to, which we're super stoked about. So we have like a new downloadable piece of content that we created that you guys can get, which actually this will be really good. It was part of what I was talking about with the 3-step process of the plan and how we deliver a plan. So this actually will go really nicely with what we talked about today in the assessment, but it kind of just dives into the mentorship and like what we're offering with the mentorship. It dives a little bit more into our podcast. So like we have access to just like all of the episodes that, well, mostly all of the episodes that we've done like on the podcast is going to be like on the website. We've done some interviews with like past mentees and like our other cohorts that you guys can check out. It's just going to be a place where we host all of our stuff now. We're super stoked about it. There's a shop on here that will continue to upgrade. Like right now we have just like the individual modules of our mentorship for sale. So people can go buy the individual module themselves. It comes along with like a PDF of the module and then a video of Will and I talking over the module, explaining it, kind of like what we did today at the start. So we have those to access for people who, you know, might not be able to join the mentorship right now, or it just might not be feasible for them. There's still opportunity to like get some of that content from the mentorship. And then just a little bit of our story of like kind of where we started and where we came from with regards to like the podcast and kind of how we got into like doing the mentorship. So just kind of a little sneak peek for you guys. We're going to probably make an announcement like soon on our Instagram page and stuff, just like launching it. But you guys can get for a sneak peek, head over there, check it out. If you want to download the PDF or anything like that, go for it. I'll put the link in the chat here. And then also what I'll throw in the chat, guys, if you are interested in more of what we're offering, like we do offer our mentorship. We are currently trying to like get our second cohort off the ground. So we are looking for a couple more people. If you found like this information to be valuable to you, something you want to learn more about, and you think like maybe the mentorship might be an opportunity for you, you can schedule like a call to hop on with me. I'll take you through, you know, kind of what the mentorship consists of, what you can expect, what the cohort's like, when it's going to be running, all of that stuff. So if you feel like it's something you want to do, you want to learn more about, I would love to chat with you guys. You can set up a call through that link there with me, and we can dive into it. But that's it. That's all we got, guys. Thanks so much for spending your evening with us. We're gonna hang around on the Zoom call for a little bit here if someone had more questions or didn't feel like they want to share in front of everyone else. But outside of that, guys, thanks so much for supporting us. It really, really does fire us up. So have a good night.
Yeah, thanks everybody for joining. Really appreciate it.
Thank you guys. Appreciate it.
Thanks, Julia.
See ya.
Thank you so much. Have a good night.
See you,
Thank
care.
you.
Stay
See you,
strong
Jasmine.
out there.